Today, we will discuss compartment syndrome, but really quickly. Are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Compartment syndrome is a serious condition that occurs when there is too much pressure within a muscle compartment, a group of muscles, nerves, and blood vessels surrounded by a tough membrane. This pressure can decrease blood flow, which can damage muscles and nerves. In layman's terms, what it is: imagine your muscles are in a sealed bag. If that bag gets too full due to swelling from an injury or bleeding, it can squeeze the muscles and nerves inside. This can lead to pain and damage. Why it happens: it often occurs after an injury like a fracture, but can also happen from intense exercise, tight bandages, or other medical issues. Signs you might have compartment syndrome. 1. Severe pain. Pain that is much worse than expected for the injury and doesn't go away with normal pain relief. 2. Swelling. The area may look swollen or feel tight, numbness or tingling. You might feel a loss of sensation or pins and needles in the affected area. 4. Weakness. Difficulty moving the affected muscles. 5. Pale skin. The skin may look pale or feel cool to the touch. What to do? If you suspect you have compartment syndrome, it's important to seek medical help immediately, as it can lead to serious complications if not treated quickly. If you think someone has compartment syndrome, here's what to do. 1. Stay calm. Keep the person calm and still. 2. Call for help. Call emergency services or get them to a hospital. 3. Don't apply ice. Avoid putting ice on the area, as this can make it worse. 4. Keep the limb elevated. If it's safe, raise the affected limb above heart level. 5. Loosen tight clothing. Remove any tight clothing or bandages around the area. Important: get medical help as soon as possible. This condition needs urgent treatment. In the hospital, here's what doctors typically do to treat compartment syndrome. 1. Check the area. They will examine the affected limb to assess the pain and swelling. 2. Measure pressure. They may measure the pressure inside the muscle compartment using a special device. 3. Provide pain relief. They will give medications to help manage the pain. 4. Surgery, if needed. If the pressure is too high, they might perform a surgery called fasciotomy. This involves cutting open the skin and the tough membrane to relieve the pressure and allow the muscles to heal. 5. Monitor recovery. After treatment, they will keep an eye on the affected area to ensure it heals properly. The goal is to relieve pressure and prevent damage to the muscles and nerves. In the case of compartment syndrome, the primary focus is often on pain management and prevention of complications. Here are some commonly used medications. Analgesics: acetaminophen, Tylenol, used for mild to moderate pain relief. Nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, Advil, Motrin, or naproxen, Aleve, to reduce pain and swelling. 2. Opioids: morphine, often used for moderate to severe pain when other medications are insufficient. Hydromorphone, Dilaudid, another opioid option for severe pain management. 3. Muscle relaxants: obaclofen, sometimes used to help relieve muscle spasms. Antibiotics: if there's a risk of infection, especially after surgery, antibiotics like cefazolin may be administered. Always remember, the specific medications and dosages will depend on the individual patient's condition and the healthcare provider's judgment. Certain people are more likely to develop compartment syndrome. Here are some groups at increased risk. 1. Athletes: those who do intense exercise or sports, especially contact sports, can get injuries that lead to swelling. 2. Injured individuals: people with broken bones or severe sprains may experience swelling in the affected area. 3. Those with tight bandages: if someone has a cast or tight wrap that doesn't allow for swelling, they might be at risk. 4. People with certain conditions: those with conditions that cause bleeding or swelling, like blood clotting disorders or infections, may also be at risk. 5. Individuals undergoing surgery: patients who have certain surgical procedures may have a higher chance due to swelling or changes in blood flow. Being aware of these risks can help in recognizing and addressing potential compartment syndrome early. Now you need to watch my video on alcohol withdrawal or have a look at seizures.